Hi everyone, and welcome to the inaugural episode of the SGH Hospital of the Future podcast. We are so excited to have you here with us today. My name is Lionel and I'm the Chief Data and Digital Officer of Singapore General Hospital. And co-hosting this first episode together with me, we have Suyen. Suyen, would you like to introduce yourself?
Hi, I'm Suyen and I'm a Clinical Director with the Future Health Systems. And we're really excited and privileged to have with us this morning to kick off our inaugural podcast, our CEO, Professor Hiang Khoon.
Hi, my name is Hiang Khoon. I like to think that I'm still a practicing surgeon. I used to operate more, but now really it's about how do we bring SGH to the next stage. I'm really excited to be taking this particular interviews. I think this is something that we talk about and we have wanted to do. How do we talk and interview and get ideas from top experts in the world about how the healthcare landscape is going to work out for the future.
Thank you very much for taking time to be with us on this lovely Monday morning. So, Hiang Khoon, it's been about 3 months, right, since you stepped into the role of CEO of Singapore's largest hospital. Maybe you could reflect on the last 3 months and share with us a little bit about how this has been for you, this transition.
I think the word to best describe this is it is mixed, right? It is a mix of learning about new things. It's also about furthering the knowledge of the things that you thought you would have known. It's about learning from all the folks that you talk to. And some of these are aspirations of the staff that work in the hospital. But there are also real challenges that is somehow standing in the way of them wanting to fulfill the aspirations they have for their career, professional life, and importantly, for our patients.
Okay. Must have been quite a complex, challenging journey trying to figure out the nooks and crannies of this hospital and all the different perspectives.
Yeah, I agree. I think it's complex, but I think it is really helped by the fact that we do have a very strong leadership team and a very, very well-structured operating framework. And I think that makes things possible. You don't feel that it is so daunting. And I think the leadership team, of course, two of you are amongst them, are people that we have worked with together for a long time. And there's, I think, a very high level of trust, which I think it just makes things easier and possible.
We're going to start with some personal questions before we go to a more macro level. And I think in your entire career that we've been privileged to know you as well as a friend, you've been a real trailblazer. And one thing that I actually remember was, if I'm not wrong, very early into your medicine career, you set up what eventually became the Children's Cancer Foundation. If I'm not wrong, that was as a house officer when the idea first started. Can you tell us a little bit more about that? And having had so many leadership positions all along, how that's placed you for your current role as CEO?
Oh, that was really history that you have dug out then. I think it started because I was a houseman, right? First posting, and you might remember how it was like. I was working in Tan Tock Seng Hospital as a houseman in the pediatric unit. And it left a deep impression on me. First and foremost, as a young doctor, you encountered the good days and the bad days. And being in an acute hospital, you, of course, see patients who have done well, but you also witness patients that perhaps didn't do so well. I lost my first patient as a houseman, and I remembered one of the nights that I really remember well when I lost my first patient. She was a young beautiful 5-year-old girl who had a advanced leukemia and had an infection in the skull. And she was in pain. I could hear her pain even while I was resting in my houseman quarters. And I remember I didn't sleep at all that night. And in the morning when she passed on, I went to the ward to sign the death certificate, and remembering seeing that the mother was just by the bed next to her and just stroking her hair and said, Angel, rest well now, there's no more pain, And that resonated with me a lot because I could see so much love from the parents, yet at the same time, I realized that when we are in the healthcare business, it's not just the patient, it's about the caregiver, it's about the extended family. And then there was another incident that really prompted me to start Children's Cancer Foundation. And this was a 15-year-old girl who was kind of a little bit out of pediatric age, but at that time, you kind of keep the patients for a longer period of time. And she was treated for leukemia, and unfortunately it relapsed. And at that time, the only potential chance for cure is to get a marrow transplant. And she had a match in a half-brother. Now the family background is a little bit complex. Mother divorced and remarried and had 3 other children. And although there was a match, the family was very concerned that donating the marrow may cause harm to the healthy child, as a result of which she didn't get the marrow that she wanted. But I think also because of the complex background, you get a child that was angry, that was rebellious, and we used to get kicked when we tried to give her medications or try to draw blood from her. And in the old wards, you have got a 42 open concept hospital. At that time, the so-called isolation room for immunocompromised patients is merely a glass a panel with a sort of half wood, but the top half will be glass. So you could look into the ward, and the patients in there can look out into the ward, but there is no HEPA filter, there's no positive pressure setting or isolation setting. And one day I stepped into the room and I saw her standing by the window, looking into the ward. Just the bed next to the window was a boy that was playing this game called theatrics. And you might remember, it comes about this bulky equipment. Nothing like the Nintendo you have. It's built only to play theatrics, right? And I don't know what came to me, but I thought, okay, maybe let me try this. So I went to the boy, and who I know has a lot of toys, and asked, do you mind if I borrow this for 3 days? And he said, yeah, okay. I took that. I went to the isolation room. I didn't wipe it down, to be fair, and I should have, thinking back. But I handed her this particular toy. And for the next 3 days, she was just on the theatrics, and her whole behavior has changed. She was responsive to us, she was talking to us, she let us take blood from her, she was taking her medication. And I realized how that little gesture or something that occupied her time has transformed her in that sense. And what was even more surprising to me was that on the third day, when I came to the ward, I kind of forgotten about this. And I saw her by the door, and then she handed me the toy and said that, you said I can have this for 3 days, and this is the theatrics, and she returned it back to me. And I think that whole event really resonated with me, and I have a deep understanding of it is really not just about the illness. It is about how the patient feel at the time, whether this is in treatment or outside treatment. If they are able to feel comfort, they are much more willing to participate in the care. And with that in mind, and that's how the initial ideas of starting a support group for children with cancer came about. Sorry, this is a very long story, but that's kind of how it all started.
No, we really appreciate and sharing, because it's obviously deeply personal. But I think we see that reflected in the priorities that you have stated in your opening address to us as CEO, that first and foremost, it's people first. Can you tell us a little bit more about the challenges with that and the plans that you have for that?
I think in the healthcare industry, we have many challenges coming up. And the advent of technology and the rate at which technology is developing will have huge impact on how we are going to function as individual healthcare providers, but also collectively as a group. What will not change is this is still a business, if you like, about people. And so when we talk about people first, it is about our staff, it's about our patient, but it is also about the population at large. We are all looking towards technology solving some of these problems that we have: aging population, shortfall in healthcare workers, how do we provide best value care, the adoption of this technology into our system. It's never plug and play in the health system. You need folks who understand the technology they brought in. They also need folks that can understand how do you get the technology integrated into the workflow in a way that is least intrusive to the staff. In fact, in a way that allows the staff to do the job easier and better. All of these requires people to change the way that they work. For us as a hospital to be successful, in fact, I would say for all future health systems to be successful, the key really is not about the technology, because the technology is already out there. It's not about the solution, because the solutions are also out there. It's about our people, how we can build a team that is willing to embrace the uncertainty, ambiguity, and willing to work together in a way that is very agile and nimble, developing teams, but also developing teams of teams that folks can take an idea, implement, and then scale in a rapid fashion. I think that requires our people first and foremost to understand the purpose of the change and willing to embrace it. And secondly, and Lionel, you spoke about this Duolingo clinicians. I think this is what we need. We need people who are not just good at clinical knowledge, which is a prerequisite, but also very good at knowledge that perhaps are not often taught, are not traditionally, conventionally taught in a medical school. Knowledge about IT, knowledge about data science, knowledge about humanity, knowledge about communications, because these are the critical differentiating factors that will allow a large organization like us to be nimble, to change, to adapt, to adopt the best technology that can help solve our problem.
I think you put it really beautifully. Right? I think ultimately the proof of the pudding is in the eating, and any solution really needs people to buy in, and people make it work. People ultimately make things happen, especially in healthcare. And maybe this is a good time for us to also talk a little bit about the next focus area or the pillar, about innovate forward. I think we look at the times that we live in. There's hardly a day goes by that there's no headline about some kind of artificial intelligence or technological breakthrough. It seems to be accelerating, moving at an even faster pace. Sometimes hard to tease out what's real and what's fiction. At the same time, we have on SGH campus one of the biggest infrastructural changes coming up in the next few years. Right? I think anyone walking around SGH will see new buildings coming up. We've launched the new emergency medicine building with the National Neuroscience Institute. We've got an upcoming elective care center. And in just a little bit more, few years away, we have the next phase of the SGH Hospital. I mean, the new building and infrastructure that we'll have. So when you think about innovate forward amidst all these changes that are happening, what are the key priorities or the key areas that you think we need to focus on, and what are some of those key challenges that we need to address?
Yes, I think that is very, very exciting times. I would maybe put it into two big focus areas. One is we truly have to set our sight firmly on building a digital-first hospital where the platforms or the digital core is wrapped around by what would be a physical hospital. We used to build hospitals and we wrap our digital processes around it. But I think in the new era, we got to think digital first and build our hospital to suit the technology. It is also very exciting because for the first time in many years that we talk about digital health, for the very first time, perhaps in the last 18, 24 months, it is within touch what ambient AI can do, what Gen AI can do for us. It's going to change not just the way that we work, but it's going to change the way that we understand how IT can work for us. It also makes it accessible. If you tell me as recent as 5-6 years ago that we will now develop NoteBuddy as an ambient AI, and this is built in-house with partners that allow clinicians to take notes that transcribe into clinical relevant material, I wouldn't believe it. But now we have rolled it out in December, and I can see that the frontline workers are really embracing the technology. And this immense capability for us to do something that can make our care better, and importantly, to make the lives of the healthcare workers better. These are win-win solutions. So I think we need to really focus on to making this a digital-first hospital. And because it is digital-first, it also means that it will be a hospital without physical boundaries. And hence, as a tertiary quaternary hospital, you have to be now very comfortable, and not just comfortable, but you need to invest in population health strategy. Because your accessibility, what you can do, goes far beyond the patient that set foot on the hospital. You now have the ability to set agendas for managing population health, because ultimately, this healthy population may one day be one of the patients within the hospitals. I think these are big changes that we're going to see in the next decade and beyond. But for that to really work, I want to go back to the initial point about people being agile and nimble and people being comfortable about embracing the change that comes to them. And it is not just about the mindset, it is also about the skill sets. So having people a frame of mind that say that, yes, I'm here, I'm very comfortable working in different teams, I have skill sets that is just beyond medical knowledge. I want to develop skill sets to be able to communicate with the patients, because the social compact between the clinicians and the patients, I believe, will remain unchanged. We will still need to have clinicians that are passionate about their work, that feel the purpose of connecting with the patients in a way that it's not just a business relationship. It is a people-to-people business. So I think digital first, and then focusing on how to get our staff, our healthcare workers to be able to embrace the technology to deliver us to that, I think is and will be the biggest challenge we have.
Yeah. Speaking of challenges, SGH is a very large organization with a long history. So very, very deep roots. And at the same time, we talk about agility and wanting people to embrace change. So there is, not unexpectedly, a little bit of tension there already. And if we triangulate all that with another focus area that we have talked about is sustainability. What are some of your thoughts and plans for that?
So let me start by saying this is, and I spoke about this in the New Year's address, that the third pillar is sustainability always. And I do want to broaden that conversation of sustainability to sustainability for the environment, but also sustainability financially. But let us focus at this moment on the environment. In US, for instance, I think the carbon footprint of healthcare as an industry contributed about 11% of greenhouse gases, maybe about 10% of toxic waste. And this is a trend that will continue to grow. In other words, the carbon consumption and the waste production is going to grow if we do not change the way that we work. Simply because the population is aging, there will be more touch points with the healthcare industry, and with higher volume of work, you're going to generate more carbon dioxide, you're going to generate more waste unless we do things differently. It is unthinkable for an industry like ours, which is based on care and compassion, to then not be compassionate about the environment that we're in. Not to mention that the very environment can itself generate a lot of problems our patients are facing, and therefore generate the problems that we will then have to solve. So I think being responsible and doing the right thing by the environment is, to me, fundamental. Now, how we're going to do it is a lot harder. And I wish I have all the answers, and I don't. But what we do need to do is, one, we know it cannot be business as usual. Number two, the old adage of you can't manage anything if you have no data. And that is absolutely true. And I think this is where we're going to start. I think we need to understand our consumption pattern. We need to understand how we generate our waste. We need to then set targeted solutions where implementing of those solutions will generate the best returns for us in terms of reducing the greenhouse gases, including the waste production. And we face a unique problem in that the bulk of the greenhouse gases are in fact not within the hospital. More than 3/4 is generated outside the hospital in the procurement process. And of those, the pharmaceutical industry probably generated the bulk of the impact to the environment. What can we as a hospital do? As a buyer, you have some influence, maybe, but we have a huge influence on what we prescribe to our patients. Maybe the first thing that we need to ask is, do we need to prescribe? Because reducing the consumption or the use of drugs is a very good way to reduce the impact to the environment. Now, that's not to say that we shouldn't give things that the patients need. Of course we do. But I think we all know that there are many circumstances where perhaps we don't need to. And choosing wisely what to do is important. I think this is something that we want to start. So I would say, first, understanding the data, where our impact to environment are. Within the hospital, that's within our control, do what is right. At the same time, change our prescription behavior, choose wisely what is needed. I think these are all ways that we can inch towards arriving at a more sustainable future for the environment.
You also mentioned the second thrust about sustainability for people, right? I think that is something that will be top of the mind of many people who are in healthcare. We navigate increasing load of work. We also have to address differing perspectives, right, of a multi-generational workforce.
Yes.
Right? I think it has been said that in an organization like SGH, we have sometimes 4 generations of staff working within the same environment, each with different life experiences, each with different perspectives.
Yes.
Right? We have a heavy demand for healthcare delivery, right? On the demand side of the curve, and on the provision side, we do face challenges, as you mentioned earlier, in terms of the number of healthcare workers we can get and the tools that we have. So in terms of sustainability for the people, in terms of well-being, in terms of motivating and enabling our staff, what are some of your thoughts in this area?
I firmly believe that one of the best ways to combat healthcare fatigue is to instill or reinstill the purpose of medicine in a very meaningful way. And where do we derive the purpose for medicine? It is through the interaction with our patients and their families and the population at large. So it is about how we move from just looking at processes and have our people once again focus on the person sitting in front of them. I think that is key. And it is also not just about the person sitting in front of them. We also know that your teammates, your colleagues are equally important. They create an environment that makes you say, wow, okay, I'm coming back to work, but also I'm working with friends that I know, people that I trust, and we're doing something together, we're making a difference. I think these are key facts. Connection with people, generating their social purpose, I can't emphasize enough. But that alone is not enough. We do have to systematically address some of the legacies of the healthcare system. One of which is, we are Superman. We can work 36 hours non-stop. When things are tough, just grind your teeth and bear it. Well, good in extraordinary circumstances. We all need that. But the truth is that not every day should be extraordinary circumstances, right? So I think we need to create a working environment that value our folks, not just what they do at work, but what they can do for their family, for their loved one, for their friends, for their social circle. Because the balance between work and life is is real, but it's also mixed, right? There's no clear delineation between work and sort of your family life and your social life. But we do need all of these different components to be strong. And that will go a long way in helping us generate a cadre of staff that are energetic, that are purposeful, that comes to work feeling that this is what my calling, this is what I want to do.
I hear that very strongly, and I like that you use the word value, because in recent times we talk about moving away from the term cost effectiveness to value-based care and value-based outcomes. Can you tell us a little bit more about your views about that and how we can do that better or more efficiently as a hospital?
If you look at the escalating healthcare costs, and this is not a problem unique to Singapore General Hospital, or for that matter, it's not a problem unique to Singapore. It is a problem that is faced globally, whether you're a developed country or you're low middle income countries. Ultimately, for us to be able to provide the best value, and the equations we all know that, which is clinical outcome over cost of providing the care, most people will now also say that patient experience is plus patient experience. But I would say that you got to put patient experience and the clinical outcome as the outcome. There is no separate clinical outcome versus patient experience outcome. They are one and the same thing. And if you put all that together, you say outcome over cost, and then I think there's a lot of clarity in there. Of course, there are many things that you can do about the cost, and you can be more efficient. You can task shift, right? You can use technology to replace the mundane work that folks do so that they can focus on what they need to do. That is one way of reducing cost. You can choose wisely. But the top line, which is the outcome, there has to be a shift from how long will the patient live to how long and happy the patient will live. And when you shift that and you look at the outcome in totality, interestingly, you might also find that some of those outcomes will in fact lead to less cost. We all know that 80% maybe of healthcare costs is perhaps in the last 2 to 3 years of a person's life. And if we respect what the patient wants and what the patient thinks is meaningful, you might find that they really, really don't want those costs that you have imposed on them. Not just from a financial point of view, but really from a holistic well-being point of view. And the short answer to the value equation that you have is to say that we cannot just focus on cost, but we have to, yes, we have to be laser sharp on making it efficient, but that will not solve all the problems. We look at the outcome, and in the outcome, we got to look at what matters to the patients. And often the patients do know and they make the best choices. And I think looking at that upper and lower half of the equation is hopefully the way for us to inch towards a value-based system.
Hiang Khoon, thanks so much for sharing your perspectives on so many topics. I think it's been about people, about innovation, about sustainability. But I did hear a little whisper next to me, and I think Sora has a little question, which I think, he was very excited to hear about purpose and passion, and he wanted to know a little bit about whether you would share some of the things that you do that you enjoy, that gives you that balance between work and life, purpose and passion. What makes you smile on a weekend?
Well, I assume my kids and my family will hear this, so I got to say, yes, my family. Not just because they will hear it, but genuinely, that gives you that balance, right? That gets, you get back home and then you connect with people in a different way. That is, to be honest with you, my kids don't care much about my work. It's just I'm glad I'm just father to them, right? And therefore, the things I talk about with them are very different from the things that I would talk about with colleagues or even friends. So I think that really gave me or gives me the anchor to life. I do enjoy physical activities. I don't have one favorite sport. The most convenient is running and swimming, things that you can do alone. I love to play badminton when my shoulder doesn't kill me. I love to play football, but it's very hard to find people approaching 60 that want to play football in a gentle way that doesn't kill my knees. So you kind of go to do activities that mainly solo activities. But I recently also picked up pickleball, which is a wonderful sport that you can't play. If you can't play squash and tennis and anymore and badminton anymore, I think pickleball is not a bad way to go. So I think that's the other thing. And I love good food, and I love wine, and I love cooking, and I'm very forgiving about my own cooking. So it's always good, but I wouldn't recommend that you taste them.
I think plenty of ideas for the SGH Wellbeing team down there.
I wanted to bring our conversation actually back to the very personal anecdote that you shared with us at the beginning of the podcast, the 15-year-old girl in the pediatric hospital. And I think the story of how you understood her needs really speaks to your personal and professional concept of people first. I like that you use technology, which in those days was the Tetris. So putting technology into health and really embedding it. And from there, I think it also speaks to innovating forwards, because drawing from your people first and harnessing technology, you did innovate forward and you charted a new course, and that has had so much impact over the past 2 to 3 decades. And Lionel and I look forward with tremendous confidence to the SGH Hospital of the future.
Well, I thank you, and I want to say once again that it's been absolute privilege to take on this role. I think it's a good platform to serve, but it's a tremendous privilege because I genuinely feel that I'm working with the best of the best, and there's a very strong leadership team that, and we have a high trust culture, with or without Sora. And I think that is probably the ingredient, right, if you will, the secret ingredient for what I hope to be a very successful future SGH. So thank you very much for taking time to speak with me and giving me this opportunity to share some of my thoughts. Appreciate that.
Thank you very much, Hiang
Thank
Khoon.
you.
And thank you very much for joining us on this inaugural episode of the SGH Hospital of the Future podcast, where we explore what's possible, plausible, and sometimes even improbable as we chart the future of medicine. Thank you.